This is Talk with Audrey. Welcome back. Well, does your back hurt? Could it be that your back pain is something more? Maybe axial spondyloarthritis. To tell us more, my guests are Dr. Hilary Norton, a rheumatologist living with AS, and Jill, a patient living with non-radiographic axial spondyloarthritis, a form of AxSpA. Welcome to both of you.
Thank you. Thanks for having us.
Thanks, Audrey.
Dr. Norton, I've never heard of AxSpA. What are the signs and symptoms?
Well, AxSpA is an inflammatory arthritis of the spine. So while most people have back pain at some point in their lives, this is inflammatory back pain, meaning that it gets better with activity and it gets worse with rest. So many people have pain at night, especially in the second half of the night. It gets better with getting up and moving around. People have a lot of morning stiffness. A lot of people have fatigue, and as this progresses, even it can interfere with activities of daily living, simple things such as doing stairs, walking, and bathing. This is arthritis that comes on early in your 20s or earlier, and it's underdiagnosed. So we know there are at least 1.7 million people living with it, and many people are not diagnosed, which is why Jill and I are collaborating with Novartis to help raise awareness for this disease.
I understand you were diagnosed in medical school.
Well, I was diagnosed in my first year of internship. So my symptoms began prior to medical school in my 20s. And like many patients, I had a 10-year delay in diagnosis. By the time I was diagnosed as an intern, my symptoms were pretty severe. And I saw, my career sort of flashing before my eyes. Before diagnosis. Like many people, I was misdiagnosed with a mechanical form of back pain prior to finally getting to a rheumatologist and getting the correct diagnosis. And that's why we want people to go to monsterpainintheas.com and take a simple quiz if you think you have inflammatory back pain, because Jill and I are trying to help other patients get diagnosed sooner.
Jill, when were you diagnosed?
I was diagnosed in 2013 after having symptoms really since my teenage years.
And how were you actually diagnosed with it? Was your back just hurting and you complained and then you went to the doctor? But what was the actual process to get to that diagnosis in your case?
So for me, like a lot of people, it's a long road. As I mentioned, starting in my teens, I started to have some unexplained back pain. 2011, I had a slip on ice and injured my back and neck. That injury really never got better and it got progressively worse. So at the time I was seeing an orthopedist, they said nothing on the x-rays, you're fine. Kept moving through, saw some other providers, was diagnosed with fibromyalgia as a misdiagnosis, and really kept pushing it because I didn't think that was the answer. And then eventually when I got referred to a rheumatologist, that changed everything. They did a workup, physical, medical history, blood work. And pretty quickly from there, I was diagnosed and got on a treatment plan, and I'm so much better.
And how has your condition impacted your life?
Took a big physical and emotional toll when the symptoms were severe. I had 2 small children who I couldn't pick up. I left my busy 50-hour a week, 70% travel job, and really was in so much pain and so exhausted I could barely get out of bed. Once I got a diagnosis that validated what was going on with the back pain, I really got into a treatment with my rheumatologist, and then I started to shift the way I looked at things and really began going after myself as a whole for improvement with food and exercise and all these things. So today my pain is minimal. My treatment plan is working. I every day try to honor the disease and give it what it needs. And really, I feel better than I did 20 years ago.
Doctor, how is AxSpA treated?
Well, when you see a rheumatologist, we're going to come up with a treatment plan that's individual for every patient. So this involves lifestyle things like Jill mentioned. It's so important to eat a healthy diet, and there's no one particular diet for AxSpA. It's going to be different for everybody. It involves staying active, not smoking, because we do know that smoking can make AxSpA worse. and getting on a medication that's going to be individual, and that's going to be a discussion with your rheumatologist. But getting on a treatment plan can be absolutely really impactful for your quality of life, as Jill mentioned.
Jill, what would you say to folks out there who might be living with some unexplained back pain?
Yeah, I think the first thing is to really become your own advocate, empower yourself. I look at it as becoming your own warrior, and recognize that what you do today to take care of yourself can have a huge impact and change everything for you going forward.
Dr. Norton, what information and resources will we find on the website?
Well, there's some great resources on the site. If you take the 3-minute quiz and it tells you that you might have inflammatory back pain, it can connect you even with a telemedicine visit with a doctor, and you can get connected with a rheumatologist directly through the site. So I would encourage people to go and take the quiz if you think you might have inflammatory back pain.
My guests have been rheumatologist Dr. Hilary Norton and Jill, a patient living with spondyloarthritis. As always, be sure to check with your doctor and or healthcare provider for more information and advice. I thank you both for joining me on the show.
Thank you for having us.
Thank you, Audrey.
There's more to come on Talk with Audrey. I'll be right back. So when you consider health priorities, are you also including your eyes? I bet you're not. I know I'm guilty of that. But when we think about routine eye exams, we often default to sort of changes in our vision. But from what I understand, these exams can also detect eye disease and some other health concerns that may have otherwise gone undetected. Joining me now, ophthalmologist Dr. Joshua Mali, and he's going to give us some tips to help us preserve our eye health and also some of the risk factors, symptoms, and preventative measures that we can basically take to stay on top of our eye health. Welcome.
Thanks, Audrey. Thanks for having me on.
How important is it to see an ophthalmologist every year for a checkup?
Yeah, it's a great time now to focus on your eye health. And, certainly an ophthalmologist is a eye doctor that focuses both on the medical side as well as the surgery side of taking care of the eye. So we do both medical and surgeries. And, there's eye conditions that, initially may not have any symptoms at all. So that's why it's so important to see your eye care doctor in order to get that eye exam, in order to help diagnose these conditions as soon as possible. The two in particular that affect the retina are called diabetic macular edema, or DME for short, as well as wet age-related macular degeneration, or AMD for short. And these two conditions early on may not present with any symptoms at all. So it's so important in order to see your eye doctor for that routine eye exam in order to diagnose these sort of conditions as soon as possible.
And what might someone notice if they have either one of those conditions?
Sure. Early on, people may report no symptoms at all, so they may not have any problems at all. But as the disease progresses to later stages, people can report blurry vision, distortion in their central vision, or even in the case of really advanced wet AMD, severe visual loss in their very center part. So this is the vision that we use to drive, to read, to get around with. So it can be pretty devastating when you can develop one of these really severe visual diseases and can lose suddenly your central vision. So that's why it's so important to maintain your regular scheduled appointments with your ophthalmologist in order to diagnose these conditions as soon as possible.
And who's at risk?
Well, for example, patients with AMD, the major people that are at risk are patients that are aged 60 or more. We typically see this in the older population. They usually have some sort of genetic predisposition, or some family members that may have the disease, and they run in families, as well as people that are smokers. So we see that smoking is a big time risk factor to worsening AMD. So it's so important to stop smoking in these patients. Now, in regards to diabetic eye disease, basically patients that have diabetes can develop complications in their eye and can develop something called diabetic eye disease, and in particular diabetic macular edema, or DME. And this is when the blood vessels in the back of the eye get damaged and you get swelling in the center part of the retina called the macula. And this is what causes the visual blurriness and visual loss in these patients. So certainly this is one of the leading causes of visual loss in patients in the working age population. So that's why it's so important to have the evaluation with the ophthalmologist to determine if you have diabetes, do you have any diabetic eye disease damage, to your eye that may lead to visual loss? So it's so important for them to monitor their vision on a regular basis.
So guys, don't forget about your eyes. It's also really important to schedule that visit with an ophthalmologist during your annual checkups. Dr. Molly, where can we go for some more information?
I highly recommend the American Academy of Ophthalmology website, which can be found at www.geteyesmart.org, as well as just consulting your ophthalmologist.
Thank you so much for joining me.
Absolutely. Thank you.
Now let's talk about allergies, peanut allergies specifically, and about what parents should know when it comes to peanut allergies in babies, young children, and teens. My guests are allergist and immunologist Dr. Mark Grijnsztein and Robin Lau, who discovered her daughter Addie had a severe peanut allergy when she was just a little baby. Thank you both for joining me.
Thanks for having us.
How common are peanut allergies, Dr. Grijnsztein?
Yeah, so peanut allergy can affect up to 1% of kids across the country, which equates to about 1.5 million children.
Well, we certainly hear a lot about peanut allergies. Why the uptick in the numbers of cases?
Yeah, the million-dollar question. I'm not sure we know 100% that, or we probably would fix it. It's probably a multi-factor thing, maybe too much antibiotics at a young age, maybe too many helicopter moms with, disinfectants and wipes and those sort of things. Hard to know.
Interesting. So what are some of the signs and symptoms of a peanut allergy?
Yeah, so peanut allergy can have a wide range of symptoms. It can be as mild as a runny nose and cough, and can be as severe as generalized rash, wheezing, difficulty breathing, and even allergic shock.
Robin, how did you find out that your daughter had a peanut allergy? What happened?
Yeah, we found out at a really young age. She was only a few months old, and I was nursing her, and she broke into severe rash and screaming and wouldn't feed. So we underwent a lot of testing with our allergists and found out she had multiple food allergies, and the most severe one being peanuts.
And how has her allergy impacted your daily life?
Yeah, so for us, we are those hypervigilant parents. Basically, we have to always pack emergency medications for her. We have to always pack her meals anywhere we go, and it's very hard to be spontaneous.
How are peanut allergies and/or reactions typically treated, doctor?
Yeah, so up until recently, unfortunately, we had no treatment, and it was just strict avoidance of the allergen. More recently, though, we have FDA-approved Palforzia by Immune Therapeutics, which is our first food allergy therapy.
Food allergy therapy. What's the difference between, say, an EpiPen, which is what most people are familiar with, and the food allergy therapy?
Yeah, so the EpiPen, which is super important, is available if you have a reaction. The goal of this therapy is to prevent reactions. So patients start coming to my office on a regular basis over a 6-month period, and we reintroduce peanut protein to the affected individual to allow their immune system to accept the allergen over time. So we're hopeful to try to, quote, cure the problem.
Wow. Robin, so this is something that you've obviously embraced. Has it been helpful for Addie?
Yeah, we were definitely excited to start this journey. I think for us, this gave us a little bit of control of knowing that this could help lessen her future severe reactions. So we fully embraced it, and this has been a really good positive change in our lives.
And knowing that Addie was going to be given the same allergen that she has a reaction to must have made you pretty nervous.
Planning to give her the one thing that we were taught to avoid at all costs. So, but we definitely trusted our allergists and knew that this was going to be very safe for her.
Well, doctor, you mentioned that the therapy is a powder. How is the treatment administered?
That's correct. Yeah, so it comes in a capsule, grated out, and you basically open the capsule and peanut protein comes out, and you administer it via applesauce or yogurt or some food.
And of course, where can we go for some more information?
Yeah, if you want more information, helpforpeanutallergies.com is a great starting point.
I appreciate you both joining me. Thank you so much.
Thank you.
Thanks.
As always, check with your doctor or healthcare provider for more information and guidance. I'll be right back. Hi there, I'm Audrey Adams. Do you want to live a better, healthier, and more financially secure life? If so, then Talk with Audrey is for you. I talk to experts from a variety of fields. We'll talk about your financial life. We also delve into health and aging, and of course, business. You can get the benefit of all these interviews and so much more. Just watch Talk with Audrey right here. And if you need more information, either about me or the show, visit my website, talkwithaudrey.com. Tell your friends, your neighbors, your coworkers, everyone you know, to join you in this pursuit of a better life. Watch Talk with Audrey. Welcome back. The coastal prairies, marshes, and bays of the Gulf of Mexico are among North America's most productive wetland systems, but tragically, they're also among the most threatened. Joining me today, Adam Putnam, the CEO of Ducks Unlimited. They're the leader in wetlands and waterfowl conservation, and we're going to talk about the crucial conservation work being done along the Gulf Coast and their partnership with the James M. Cox Foundation.
Thanks, Audrey, for having us. This is such an important topic.
It is indeed. Everybody's talking about climate change and the impact that we all have on our ecosystems. Why is the restoration of the coastal wetlands and marshlands important ahead of this hurricane season?
Well, then let's set the stage here for some context, which is that the lower 48 states have lost the overwhelming number of wetlands acres across the continental U.S., and 90% of that loss has been along the American Gulf Coast. And so as we approach hurricane season, it's important to remind people that in addition to half of the birds and 2/3 of the fisheries spending some portion of their life in these wetlands ecosystems, those wetlands ecosystems, those mangroves, those barrier islands, those marshes, they're also the best shock absorber that the U.S. coastline has against these hurricanes. And so when you have that natural infrastructure, it breaks down the energy of that tide, of the wave action, of the wind action coming ashore, and means less damage and less dollars lost in damage to our cities and towns. So this partnership really allows us to leverage dollars and rebuild those sensitive and fragile coastlines where, in addition to birds and fishes, humans like to spend a lot of their lives as well in these coastal communities.
And when you talk about restoration, are you replanting and regenerating vegetation that's been lost over time? And how long does it take to reestablish the growth of the vegetation?
You know, it's amazing how fast nature can rebuild if given the opportunity. And so when you look at a project like what we're doing with our Gulf Coast Initiative here in Louisiana, with the support of the James M. Cox Foundation, we're capturing the sediment that's coming down the Mississippi anyway that used to be the rebuilder of these marshes and coastlines. And we'll construct breakwaters and terraces that allow that sediment that's coming down anyway. We don't have to barge it. We don't have to mine it. It's coming down anyway. It allows it to be captured by those breakwaters. It helps to reestablish those seagrass beds and those plant communities. And it actually results in shoreline being extended. We're actually creating shoreline or recreating it because it's been lost over the last century. And when you do that, the birds and the plant communities, they take over and accelerate that natural process. And that means that if you have another active hurricane season, you have put more land, more marsh, more wetlands between you and the people. And you have these plant communities that are helping to absorb the power of that hurricane, which studies have proven reduce the insurable losses to the cities and towns that are behind those wetlands.
Does Ducks Unlimited take contributions, Adam?
Oh, from time to time, we're happy to do that if people feel so inclined, and they can do that through ducks.org as well. We're a membership-driven organization. We're a volunteer-led organization. We have 45,000 volunteers across the United States, and some of our most passionate ones are along the U.S. Gulf Coast.
And if you'd like to get involved, check out that website, ducks.org, and see what you can do to help preserve the wetlands along the Gulf Coast. Adam Putnam, CEO of Ducks Unlimited, has been my guest. Thank you so much for joining me, Adam.
Thank you for having me.
There's more to come. I'll be right back. You're watching Talk with Audrey. Welcome back. 12 years ago, Travis Boersma, the co-founder and executive chairman of Dutch Brothers, the nation's largest privately held drive-through coffee company, lost his brother and co-founder, Dane Boersma, after he was diagnosed with ALS. To honor his memory and raise awareness about the disease, the Boersma family and Dutch Brothers started Drink One for Dane. Travis, thank you so much for joining me.
Well, thanks for having me.
Tell us about your brother Dane and the campaign you created to raise funds for the MDA to support ALS research and services.
Well, going back 15 years is when we started this thing, and my brother was well into it when we fired off our first Drink One for Dane Day. In 2004 is when Dane had the early symptoms, and his speech was just minorly starting to slur, and we kind of laugh. I'd say, "Hey man, you got fat tongue. What are you doing? Are you drinking or something?" And he would laugh, I would laugh. It slowly started to progress, and how you really detect that it's ALS is over time. There's no diagnosis out of the chute. There's nothing that tells you that you've got it outside of losing the use of your muscles. And he ruled everything out by turning every rock over as far as, cancer, tumor, stroke, whatever you could ever imagine. You try and figure out if there's something going on, and everything would come back clean. So the disease started to progress. His speech started to slur more. His swallowing started to become more challenging, and even breathing diaphragm had its challenges. So brutal, horrific disease. Anybody that has ever, gone through this, what I'm talking about, and the effect it has on family, on friends, on everybody is just heart-wrenching. So when we started the campaign, I guess it's 15 years ago now, it was really with the mindset and the commitment that we would do this annual day. We donate a portion of proceeds to find cause, find cure, provide services for people that go through this thing. And to date, we've raised like 8.5, maybe somewhere in that neighborhood, $1 million. 8.5 million. It's hard to believe, but our goal, and we really believe we're going to hit this number. 1.6 on the 14th of May here is our goal. And if we hit that number, or I should say when we hit that number, we'll eclipse $10 million over 15 years.
I stop at Dutch Brothers for my cup of coffee whenever I fly into the Sacramento airport. But what if you don't live close to a Dutch Brothers? Is there another way to make a contribution?
Absolutely. So, if for anybody out there, you can go to dutchbros.com. That's the easiest thing. We accept all donations right there. It gets routed over to MDA, and they've been an unbelievably great organization to work with. So dutchbros.com, donate there. If you've got a shop close by, hit it up, grab a cup. It's a big day for us, and we're looking forward to finding a real root cause of this thing.
And God knows, as I'm sure everyone else does, that we're hoping for a cure. Travis Boersma, thank you so much for joining me, and thanks for all that you and your family are doing to help find a cure for ALS. So guys, visit the Dutch Brothers website and drink one for Dane.
Thank you so much. Thanks for having me.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information on Talk with Audrey. I'll see you next week.